Hello, I'm Lesley Wiesenfeld. I work as a psychiatrist on the medical and surgical wards at Mount Sinai Hospital in Toronto. I mainly help patients who have depression or anxiety or dementia or other mental health problems in addition to the medical issues that brought them to the hospital. I'm also the chief of psychiatry for Sinai Health. So when our hospital started preparing for COVID in February 2020, I was involved in trying to figure out how to continue to deliver psychiatric care during the pandemic. We were expecting a surge of COVID patients, so we actually weren't sure about what psychiatric care we would be able to deliver or whether the COVID needs would overwhelm the hospital. Like everyone else, we were watching the news of what was happening in China and in Italy and later in New York. We didn't know whether we'd be doing our usual work only with masks and new protocols, or if we'd be asked to provide medical care instead of doing psychiatry. As I think back on the early days, I remember feeling that we couldn't prepare fast enough. It felt like we were drafting so many new policies and procedures that each one became out of date the moment I emailed it to our team. The science and guidelines were evolving so quickly. I also remember when I saw my first patient with COVID. He was an older gentleman who had just lost a family member to COVID when he tested positive himself. He wasn't very sick physically, but he was alone and he was sad. And my medical colleagues wondered if he was depressed. Normally, in pre-COVID times, I would have sat closer to him so he could hear me while we spoke. He would have been able to see my whole face so we could develop some connection, some rapport, but we couldn't do that. It actually took me a while to realize that he couldn't see the expressions on my face under my mask. Even though I thought I was responding to him and showing him that I understood, it didn't feel the same when we were speaking. I really felt like I was working without my usual tools. Trying to figure out how to still make these important connections has been one of our biggest challenges to work through during COVID. As our hospital was preparing its medical response to COVID, our psychiatry department and our colleagues in spiritual care and in ethics also were working on a plan to help our staff cope emotionally. We knew from our experience with SARS that working during the pandemic was going to stretch and stress our coworkers and us. And we also began to realize that COVID was different because people were not only dealing with COVID at work, but also at home and in our families. What we did is we developed a group of what we called resilience coaches, so we could use our expertise to help our colleagues to keep their heads in the game and avoid burnout. Our coaching has mainly taken place through support sessions, sharing coping techniques, helping people to develop skills to manage the uncertainty and the strain and the fears that go along with trying to do their usual work in this very unusual time. Lately, our coaches have been reflecting on what teachers and principals and school staff might need as they also try to do their usual work during this pandemic. We imagine that, like us, teachers are probably trying to figure out how to connect while wearing masks and keeping a distance. And we imagine that also, like us, teachers are finding that plans change frequently and that their friends and family members are probably peppering them with questions and maybe even giving unsolicited advice. So we put together these short videos focused on coping and resilience. We hope that sharing our experience and the approaches that have helped us might also help you. We're not experts in education. We're not child psychiatrists, we're not infectious disease specialists, and we're definitely not experts in what the best school plan is. Mainly we're healthcare workers who are also daughters, spouses, parents, friends, who've tried to continue to do our usual work during COVID, to coach our colleagues who are trying to do their work. And we hope that sharing some of what we've learned may help.